Hi everyone, this is Mehl-Madrona here with Dr. John Dye, who's an old friend whom I've known for probably 40 years. It's hard to remember when we met anymore,
At least 40 years, yeah.
at least. So John is a naturopath who lives and practices in Sedona, Arizona. He's a professor emeritus of mind-body medicine and naturopathy at the Southwest College of Naturopathic Medicine in the Phoenix area. And John and I are in process of preparing a webinar on intuition. So John, what are your thoughts on intuition?
Well, I think one of the main distinctions that I would like to propose that we cover is that there is a role that is quite often missing in medicine. There's a role for investigating more subtle influences that come from the psychological and the spiritual and the mental realm, and other influences that are not easily measured in objective conventional medicine. And yet it's pretty clear when you dive into those realms that they have a huge influence. And not only that, but the subtle, the mind body, let's say, connection is useful. You and I worked together, the 40 years ago in obstetrics, and we found huge. I mean, we made part of our practice to evaluate and assess risk factors that were the psychological ones, and it actually lowered our risk for C-sections, and we had much better outcomes. Now, in medicine, since I have not been doing births for a long time, but in medicine, we find huge uses for intuition. The problem, though, is some people, when they're trying to use intuition, and maybe they're using things like muscle testing or some other kind of way of seeing that is unconventional, they exceed their boundary and maybe start making medical diagnosis or conclusions that are not defensible, that are actually distorted in some way from objective data. So I think a lot of it is to respect from the maybe scientific conventional realm that there is a role for intuition, and at the same time, uh, with the intuitives, to the same in reverse, so that we can integrate them. We're going to cover that in this workshop.
Right, and um, if you would like to know more, we have a longer video in which we discuss this further. But this was a short introduction to the thoughts that we'll be discussing. So we thank you for your attention.